we're now going to do a little bit of a recap of where we've been on this journey with the Healthy Climate Prescription Letter, and then the rest of 2022, what we see on the horizon through this year and in the run up to the next UN climate negotiations in November. So last year, the Healthy Climate Prescription, as you all know, as signatories, came together. The letter came together last year, and the writing of the letter was really done by members of the Global Climate and Health Alliance, members of the WHO Civil Society Working Group, and we, as the GCHA Secretariat, had the honor to kind of spearhead that writing process. And then the letter was circulated around the world to the health community, and the health community, all of you, really recognized, I think, that this was a moment where we as health needed to come together and raise our voices collectively to call for strong climate action. And this letter was written in the run up to the last UN climate negotiations, COP26 in Glasgow. The letter was carried, as in the picture that you see here, was actually physically carried by bicycle by doctors from the UK, starting in Geneva by a member of the WHO, carried from Geneva to London, and then from London to Glasgow to be delivered to heads of state and climate negotiators at the UN climate negotiations. It was launched at the same time as, and alongside the WHO's special report to COP26, making the health argument for climate action. It was delivered in a UK COP26 presidency event, a health event focused on health and on the launch of this, or the delivery of this letter, as well as the launch of the health program, the COP26 health program. With its delivery, there was also a video released that brought the actual voices of health professionals from around the world to this issue. And that video was viewed 40,000 times on social media in the first 5 days. And as you can see here, the letter also got media coverage. So that was sort of the kickoff of the letter and the delivery of the letter. To provide a little bit more of an overview of activities in 2021 from the UK COP presidency perspective, and also talk a little.
Jenny,
yeah.
I haven't, unless Leonard is here under another name, he's not logged on yet. So I wonder if we could flip. My apologies to interrupt you. I wonder if we could turn to Omnia first.
Okay, very good. All right, we'll come back and hope that Leonard Ted will join us shortly. But instead of recapping last year, before we look ahead from the UK perspective, we'll go the other direction and look ahead to this year. So with a perspective from the ground in Egypt, looking at preparations for the next UN climate negotiations, I'm going to turn to Dr. Omnia El Omrani to hear a few words about what's happening in Egypt, how the preparations are going for COP27. Omnia, over to you.
Yes, thank you so much for having me. It's always amazing to see the work done by GCHA and WHO, as well as with the prescription letter. One thing I would love to share, I just came back from Amana Climate Week, which is the first ever climate and health, climate change week organized by the UN CCC on climate change in the Middle East and North African region. One of the key things that we highlighted that this year and the next year, COP is going to be in the region, being Egypt in 2022 and then Dubai, hopefully Emirates in 2023. And this presented a great opportunity for engagement on the issue in terms of what Egypt is doing for climate change and what the health community specifically is doing. So my university, which is one of the biggest public universities in the country, which is Ain Shams, it has been organizing a series of conferences discussing climate change and health, working on engaging more healthcare professionals in the issue from an educational perspective. My university also suggested that they would like us to organize the first ever climate change and health course for medical students to learn about the issue and for it to be the pilot and the first time in the country to have climate change taught at a medical faculty. And this is also because of Egypt being the host of the climate change conference. So there is a big, I think, opportunity from an educational perspective to advocate or integrate climate change. But I think there's also a gap when it comes to engagement of civil society and healthcare organizations. Still, climate change not seen as a priority, or maybe the how to engage and how to advocate for climate change from a health perspective is still a gap, but also an opportunity for the global climate and health community to engage more the health community in Egypt to advocate and to raise awareness. And at the same time, in MENA Climate Week, I saw many plans and many engagement for Egypt in terms of how to work more on shaping climate resilient and sustainable healthcare facilities. This is one important area. And this also has the specific engagement of the Egyptian Ministry of Health, as well as with WHO Egypt. And on the other hand, there are also many research initiatives looking at the intersection between health and climate change, studying its impact, specifically in the MENA region, as well as in Egypt. And one final thing, which is very excited, we are currently working on a policy brief with the Lancet Countdown on climate and health for Egypt, to be able to utilize this ahead of the subsidiary, the June UNFCCC meeting, as well as to be used for COP, looking more at the impacts of climate change and health in Egypt and communicating with stakeholders like the Ministry of Health, the Ministry of the Environment, and so on. And also one important thing that we have in Egypt right now, because of COP, strategy for climate change for 2050. And this strategy is aimed from a multidisciplinary level to engage not just the Ministry of the Environment and the Ministry of Finance, but also looking at the Ministry of International Cooperation and the Ministry of Health. So there are also other engagement coming from the youth and health organization, which is IFMC Egypt, and we are really looking at, and there is an opportunity for climate engagement from a youth and health perspective, as well as from a gender and health perspective. So I won't keep longer. I know I hope we are very short on time, but looking forward to your questions, suggestions, and thank you again for having me.
Thank you so much, Omnia. Such a pleasure to have you with us. And thank you for all the work that you're doing on the ground in Egypt to elevate the health issue in the context of this COP. It's just extraordinary to see the progress that's happening. Very exciting indeed. Very good. Okay. So now we will, we've just looked forward a little bit. We'll look back a little bit and also get a different perspective on the work this year from Leonard Ted of the UK Foreign, Commonwealth and Development Office, representing the UK COP26 presidency, to talk about the COP26 health program last year and where that is going this year from the UK government's perspective. So Leonard, over to you.
Thanks, Jenny. How much time do I have?
5 minutes, give or take.
So I'll be short. So thanks so much. It's great that there's many of you on this call, nearly 150. That's really grand. So greetings from Glasgow. I'm here in Scotland. It was great to see many of you. I'm sure many engaged in different ways with COP26. It was a real step change moment. I mean, we really felt that. So many countries, I think 57 at the current count, made commitments on climate and health, drawing the sort of major narratives in climate discourse around net zero and reducing emissions, making that applicable to the health sector. Similarly, really considering resilience in the sector, and then of course lots of the associated areas around how the research agenda contributes to it, and how practitioners and health sector professionals can engage with the agenda. So we feel that on all four of these fronts, it was a real step change. And also, of course, this is an agenda that's just going to build and build as we, humanity, better understand the impacts of climate change. Even though, of course, current affairs puts a lot more on the immediate agenda. Climate will just grow and grow, and it'll grow subnational, national, regional, and global levels. So it's great to hear from Egypt around some of the thinking of how this frames into COP27, and we're really interested in bridging from 26 to 27 and where it goes from there. So at COP26, I mean, it was just something quite remarkable to see, having a large, busy health pavilion in the margin of the formal discussions, having Tedros, WHO, saying the WHO's commitment to follow up and supporting countries, and WHO network support. Having the health, and so although the health and climate commitments at COP were sort of in the additional category of processes outside of the formal UNFCCC negotiations, although there was mention in the formal negotiations and in the but the fact that Espinosa, in concluding the whole COP conference, referenced the climate and health progress in closing, I think was significant, and certainly we, the UK government, in the sort of major outcome documents that described everything that there was in Glasgow, the health and climate. There's a short 2-pager which I can put a link to in the chat here. That was, we really felt sort of summed it up. So I mean, we're then, I mean, what we hoped to set up was to reflect these four, and that what we wanted from COP was to generate the momentum, and then it's a collective responsibility across the whole raft of public sector policy framing, finance, and health sector delivery. So we collectively, all of us, we tried to raise the issues. We did that successfully. We gained governmental commitment, and from that, where do we then go? It's in all our gift to build on that commitment. It's really interesting, some of the plans for this year, different organizations interested in advocacy campaign work, the Partnership for Action on Climate and Health. We've had more countries looking to join, some who weren't quite in position ahead of the November conference have picked up on it since. And within all of that, the importance of civil society in gaining those commitments in the first place, but then particularly in follow-up and scrutiny around what that then leads to is absolutely critical. The voice of health practitioners, civil society more broadly in the climate and health space, that keeps us focused, keeps leads to the action that follows up, reminds around the commitments, can seek the detail of action plans that follow that, and then it will build on from there. Yeah, so that's just a sort of a quick, that's of a colleague, Helen Yaxley, who's the point lead in ourselves in the global health part of UK government, oversees aid section as part of Foreign, Commonwealth and Development Office. We used to be DFID, and so we look forward to continuing partnership. Thanks, Jenny.
Thank you so much, Leonard. And yeah, it was delightful working with FCDO, FDCO. I flip those regularly, but lovely to work.
Maybe easier than DFID.
Lovely to work with you all last year. Really great to get the attention on health from the UK government while you were president of, you all were I guess you're still president of COP, the outgoing president, and really fantastic to be able to work together and elevate health along the way in the run up to COP and at COP itself. And thanks for teeing up some of the things that folks can be doing going forward in relationship to those health commitments. In the breakout sessions later in this meeting, there'll be an opportunity for people to join a session that takes them deeper into what they can be doing on those health system commitments, as well as other areas that were highlighted, other calls to action in the Healthy Climate Prescription. Okay, now at this point, we looked ahead to COP27 and heard from Omnia about work on the ground in Egypt. We've heard from you, Leonard, about from the UK perspective on the work last year and this year. COP27 being based in Egypt is kind of quite interesting because it is both situated in the MENA region, the Eastern Mediterranean region, but it is also the African COP. So Egypt is hosting the African COP. And so to get a bit of a perspective from that lens, through that lens, about this year, the work on climate change and health, and looking ahead to this set of climate negotiations focused on the issues facing Africa, I would like to turn over to Martin Muchangi, Program Director with AMREF Health Africa. So Martin, over to you.
Yeah, so thank you so much, Jenny and colleagues, for having me here. Certainly, Africa is facing the triple crisis of climate change. Of course, all of them are cyclical because it's climate change, it is health, and it is the economy of the people. And unfortunately, when you look at the demographics, women and children are the most affected. And so from the organizational perspective, the organization which I work for, AMREF Health Africa, and the partners who we are joining hands together, we are so much aware that even if we try to our hardest to address the healthcare systems, we are not going to achieve much if we don't get our hands, our voices to address climate change and health as well. So basically what I'm going to speak about is what we have done together with our partners. As I spoke earlier on, we came together as a caucus of a few NGOs, private sector actors, and the government, and we are looking forward to forming a voice and a coalition that can then start advancing the climate change and health agenda, especially in Africa, the Global South. Now, there are three-pronged approaches that we are taking into consideration. The first one is raising the voice. And in raising the voice, we are looking at forming the strategic alliance. And this strategic alliance is basically like what we are having here, the conversations that we are taking here, and many others. We are trying to seek to join many other coalitions that can help us to amplify the voice around climate change and health. The second thing is around the events which are planned. We want to use them strategically, and I would want to announce, I know Jenny, on behalf of all of us, you are going to announce later that we are going to have a signed event at the World Health Assembly. And basically it is about climate change and health as well. It will be followed by SIWI. We will be in Stockholm again, speaking about the same subject, and then COP27. So all what we are trying to do around this theme of raising the voice is coalescing all the ideas together, putting them in a manner that we can start influencing the politicians, the political arena, those who are financing, to start thinking about investing directly in climate change and health. I know there's a lot of attention in terms of agriculture, transport, etc. but health is not mainstreamed in this conversation. So that's what we want to do. The second element is around optimizing programming. We have invited ourselves to say that we know very little about what key impacts that interventions that climate change oriented can have on health directly. So we have decided to take targeted pilots or data-driven pilots and basically focusing on One Health principle. So taking One Health, looking at the animal health, the human health, and the environmental health all together, piecing that, trying things and documenting them and speaking about them strongly. Now, we are taking forward the message around COP26. We have decided to support a couple of Ministry of Health programs in Kenya and Uganda to begin with, to start doing the vulnerability assessments, check what comes out of that, and then we see exactly what we can do in terms of programmatic intervention. And lastly, the third prong approach is research and learning. We are organizing a series of webinars, inviting university students to run with us, understand what we already know, invite them to undertake research that can help us in proper programming. So household air pollution is one of the themes which we have taken forward. And we also want to see, of course, it's also embedded within the One Health philosophy that I spoke about. Yeah, so I want to stop there, but simply say that we look forward to organizing ourselves to appear in COP27 in a very big way. Just calling all of you to support these aspirations and the movement that we are trying to form. So thank you so much.
Thank you so much, Martin, and really exciting to be to have the opportunity to collaborate with you and support your leadership and AMREF's leadership and efforts in the region to elevate the issue of climate and health, to bring the health voice to all of the kind of meetings and events that are happening this year, and to bring the perspective from the African continent and the particular issues that are happening there, as well as the solutions that can be developed there to really drive change. So thank you so much for sharing all of that with us. Looking forward to working together to take all of that forward. Okay, so we've had a bit of a look at what came last year, a bit of a look at what's happening this year. We're now moving into the section of the agenda to begin to think about what you all of us can be doing in the next several months. And right now we want to focus on the period between now and sort of early to mid-June. After this meeting, we will share with you a toolkit that GCHA has pulled together. It has resources not just from ourselves, but from a number of health organizations around the world. And the reason we think it's important to focus on this period right now in the lead up to June is that there are two really important meetings coming up in June. The first is Stockholm Plus 50, which is the anniversary of a Right to a Healthy Environment initiative. And then the other key meeting coming up in June is the intersession meeting of the UNFCCC. The UNFCCC, of course, is the UN body that convenes the COP meetings. This intersession in June is the moment when much of the agenda for COP gets set. And so raising the health voice, bringing the health argument, calling for what we want to see in climate action from a health perspective to protect people's health and deliver on the benefits to health that we know are possible. We want to get that in front of decision makers and negotiators ahead of that June meeting in Bonn, as well as the June meeting in Stockholm. To give an initial taste of what a couple of organizations have done with the Healthy Climate Prescription Letter as an example of what your organization, other organizations might be interested in doing. I want to turn to, and unfortunately, one of our speakers is not going to be able to speak, but I'll mention the initiative that she worked on on her behalf. And then we have a representative from the other organization that I'll turn to momentarily. The first initiative that I want to mention is we had hoped to have Dr. Purnima Prabhakaran from the Public Health Foundation of India. And in India, she worked with a number of health students who developed their own climate and health manifesto. After reading the Healthy Climate Prescription Letter, they took up the initiative to write a climate and health manifesto that got signature from thousands of health students, was circulated widely on social media. There's a website for it that is actually a part of the toolkit we'll share later. There's a link to it there. And they're now looking for an opportunity to actually deliver it to decision makers in India this year. So that was a very exciting initiative. And to share another kind of similar initiative that took the Healthy Climate Prescription Letter and then took it national in a different way, I am honored and pleased to turn over to Dr. Jeff Blackmer, who is the Executive Vice President for Global Health and the Chief Medical Officer at the Canadian Medical Association. So Jeff, let me turn over to you. Thank you for joining us.
Thanks so much, Jenny. Great to be here. And it's so, I think a lot of you feel like I do. It's so energizing to be a part of these conversations with people who have the same interests and goals and passions that you do. And so really appreciate, the opportunity to meet like this, and many thanks to GCHA and others for convening this meeting, and really a pleasure to be able to just share very briefly a little bit of the work that the CMA has been doing on this file. So the CMA represents over 80,000 physicians in Canada, and we're what I would call a mainstream medical representative organization. And by that, I mean, we're not specifically focused, for example, on climate change, but we're working on hundreds of issues of concern to our members and to the medical profession. So that presents us with some challenges, but it also presents us with some opportunities. And it's been great to work with Jenny and others to try and sort of reach out to our brother and sister organizations across the world to try and get them engaged in some of these activities as well. And the Healthy Climate Prescription is going to be a great example moving forward of the role that these national medical associations can play in this critically important area, an area where traditionally they have not really played a huge role. So just backing up really briefly, in 2021, the Canadian Medical Association, and I'm glad to see we have a member online, thanks Samantha, developed a new strategic plan. It's a really ambitious and sort of far-thinking plan called Impact 2040, and by its name you can tell that we are thinking a number of years out. And one of the priority strategic initiatives, and there are 7 sort of initial priority strategic initiatives, is working towards achieving a net zero healthcare system. And the rationale was really, although we recognize that we need to do work on addressing the health impacts of climate change, and we'll continue to be active in that area, we also need to get our own healthcare system, our own healthcare house in order as part of our responsibility towards the broader issue of climate change and health. So this is really key towards, in Canada, certainly key towards meeting our nationally determined contributions and moving Canada forward towards net carbon zero emissions by 2050. Similar to other systems internationally, our healthcare system in Canada is responsible for 4 to 5% of all emissions, depending on how you measure it. So that's a pretty significant contribution that we really need to address aggressively as a healthcare organization. So what is our role in this area? We're really trying to get this on the agenda of healthcare organizations and governments domestically and internationally. And there are a number of opportunities that we have and that other similar medical associations have. All of us have strengths in policy advocacy and communications. In many ways, that's sort of our bread and butter. And turning some of that machinery towards issues like this can be very, very, very powerful. We also have the opportunities to support and provide funding to experts and other organizations and engage and develop partnerships with stakeholders in this area. The other thing that we can do in a really powerful way is mobilize medical professionals to be stewards of sustainable health systems. And there's a number of initiatives in Canada underway in this regard at the moment. And we're really excited about bringing a lot of people together around some of the same tables. And I think, again, this is kind of like the value add that national medical associations have in this area. It's really important to recognize it can be politically challenging for national representative bodies to get deeply engaged in these spaces. If you think about the traditional role of an association like ours, we generally essentially represent the interests of our members, whether that's in terms of things like finances and reimbursement for services, or with respect to the role and the position that they have in the healthcare system. So it tends to be much more inward looking rather than outward looking. And it's hard to turn that ship around really quickly when it comes to important issues like climate change. This is something that we've really been working with both internally within our organization, but also again, with sort of our brother and sister organizations across the world. So we see part of our role now is to provide some of this convening power, as well as in some cases, political cover for these other mainstream representative medical organizations. So we reach out to them and we say, look, if you want to go to your membership and say, you know, the Canadian Medical Association is doing this, we think we need to follow their example. That's great, you know, because it points to this idea that others are doing it. We don't want to be seen as sort of laggards in this space. And we've had success with that approach with a number of other organizations. So to the healthy prescription level, healthy climate prescription letter, as you all know, GCHA did a great job bringing together global leaders in this space. And what we saw was that last year we started receiving a number of emails from other healthcare organizations in Canada, and I know many of those are on the call today, thinking about how we would approach the government of Canada prior to COP26 and how we could, as all of you are interested in, how we could get healthcare on the agenda. We also recognized at that point that many of these organizations were a little bit siloed. And so again, back to this idea of healthcare organization as convener, we used our ability to convene organizations to bring them together to really try and present a stronger, unified voice for greater impact. And I think that's really the take-home message here, is the ability of many of your organizations to convene and bring together voices around a common cause. In this case, it was the letter that really provided the impetus for us to be able to say, look, we've got an opportunity here. We're headed into the COP meeting. We know the government of Canada takes this very seriously. We know they're very engaged in these discussions. How can we leverage all of those things to make sure that health is on the agenda for them? And it was really around the letter that provided us with that opportunity. So we crafted a very focused message using this as a template to urge the government to limit warming to 1.5 degrees and ensure that low-income countries get the funds needed to protect citizens from global warming that richer nations have caused. And we really used our position to help unite these voices. So again, I think just thinking about what you can do as healthcare organizations, there's some real opportunities in terms of convening, but using really the power of the healthcare voices, as we've seen in this initiative. You do have powerful voices, and it's really a matter of thinking beyond sort of your normal, maybe your normal files, your normal activities, and much broader in terms of kind of the societal considerations. And then, you know, we've got lots of work ahead of us as an association. Much of it is working with GCHA and many of you around the virtual table here today. Really looking forward in seeing how we can leverage this moving into COP27. We unfortunately were not able to be in person because of travel restrictions at the last one. We helped support a fantastic meeting through Jenny's team in Madrid, and really looking forward to seeing what we can do moving forward into Egypt to not, now we've gotten this on the agenda, now we need to really leverage the strengths that we have and the impact that we have and the respect that we have as healthcare providers now to move that forward. So Jenny, thanks so much. Really appreciate the opportunity to talk about our work, and again, encourage others to do the same. Always happy to meet with folks virtually and in person to talk about the work that we've done and anything that we can do to help other healthcare organizations globally. Certainly willing to do whatever we can to be of assistance. Thanks very much.
Thank you so much, Jeff. Fantastic to hear about the work that the Canadian Medical Association is doing. And to your point, what GCHA has seen during the decade or so that we've been around is that kind of peer-to-peer, whether it's individual health workers and health professionals connecting with one another to work on the issue of climate change and reinforce one another, or whether it's kind of peer organizations to peer organizations thinking about how do you do this, what's the right voice for the health community, where do we step in, how do we engage. It's really powerful. So thank you so much for sharing your efforts and for that generous offer to connect with others who may want to go down this path. Really fantastic. So, and that's a great kickoff to thinking about what are we really proposing to do together this year. You know, we talked about the letter coming together and last year, the overwhelming sign-on by the health community around the world, really unprecedented and really sort of establishing a kind of consensus set of calls to action. But we know that COP26 didn't fully deliver what we needed to see. So we can't rest now. We need to keep going. But we also have this kind of collective, we've come together. We have kind of the network, the movement really as a community to go forward. But what actually should we be doing this year? We've highlighted the period between now to June. We think that that's a ripe opportunity. There's also advocacy and action, direct type of changes that can be made in your own workplaces or health systems that can be an ongoing process. And all of these things will contribute to moving the needle, some of them within country at the national level, within health systems, and some contributing to this kind of voice at the international level. So GCHA has pulled together a toolkit of resources to help you think about what your next steps could be to move the needle on the issue of climate change and health this year, building on this tremendous coming together around the healthy climate prescription. There are resources for national advocacy in each of 4 key policy areas coming out of the letter. And those 4 key policy areas are phasing out fossil fuels with a just transition, strengthening national climate commitments so that they really deliver or get as close as possible to limiting warming to 1.5 degrees and building health into those national commitments and national policies. Investing in resilient and low carbon health systems, and also delivering the climate finance that has been promised to low-income countries from high-income countries in order for the low-income countries to be able to mitigate, adapt to, and become more resilient to climate change. The toolkit that we've assembled, it has materials that we've developed as GCHA. It has materials that other health organizations have developed that we think are really good. All of these materials, however, have been developed, in a particular context with the knowledge that either, GCHA's secretariat has, or the organization that developed the tool. So we know that those are not perfect for every context. We strongly encourage you to take what's in this toolkit and adapt it. So if we've provided a template letter to your prime minister or a template op-ed that you can use with your media, adapt it to your context, adapt it to what makes sense in your setting. But in addition, help us make this toolkit better. If you have great materials that should be added to this toolkit or should be shared with the global health community to help everyone become better advocates and better actors on the climate issue, share those with us, and we will make sure that they're shared with the community that we've gathered together here. And finally, one of the things that helps build momentum is hearing about what others have done. So Jen has developed a Google form that enables us to collect information from you about actions that you've taken. Please use this Google form to let us know if you've published an op-ed, if you've initiated something within your health system to decarbonize or make your health system more resilient. Anything that you're doing, share it so that we can share it with the rest of the health community and both build people's understanding of what's possible and energize people and get them excited about what others are doing and what they might be able to do. Okay, with that, I am going to now turn over to Jen, who's going to lead us through a little exercise. Today is not just about listening, as we saw from the very beginning with the breakout where you got to know each other. It's also a bit about doing and beginning to take those actions and preparing to take those actions. So I'm now going to turn over to Jen to lead us through a little exercise. Jen, over to you.
Thank you. So one of the things that we sometimes hear is that I think health people are very careful with science and very careful with wanting to make sure they're delivering accurate information. And so sometimes we've heard people be cautious about talking about climate change because health professionals feel like they're not experts in the climate science, don't know the ins and outs of melting rates or heating rates. And I think the biggest thing that I want to share is you don't have to be experts in the climate science. You're already experts in health impacts. And we've seen talking about health impacts be extremely powerful in convincing the public and convincing government decision makers that swift action is needed to protect health from climate change. And so we wanted to take a moment to just have a quick practice talking about climate from a health lens. And if this is something you do a lot that you're really comfortable with, we also invite you to share, to give examples to others. So the first practice we're going to do is the impacts practice. So we're going to invite you to share your name, your profession, where you are in the world, and a health impact that really concerns you. So I would say my name is Jen. I live in Vancouver, BC in Canada, and I work in public health. And a climate impact that really concerns me is the forest fires that have happened almost yearly in this province, and what those fires and the smoke from those fires will mean for the health of children, children who are really young and are breathing in smoke every summer. And so I know all of us have something similar. So again, we're going to take a practice just in the chat, sharing your name, your profession, where you are in the world, and one climate impact. So just take a quick moment and drop that in the chat as to just practice with that frame. We'll give you a quick 30 seconds. we're seeing buildup of air pollution. Give another few seconds. Food and water, impact of heat from Sam in Toronto, impact of natural disasters. I think one of the things we see also that are really powerful is if you can talk about something really specific. So just noting the, in the Brazil example, Mariana is talking very specifically about the place that she's seeing the disaster happen and the people it's impacting. And I talked about kids because I actually know some kids whose parents felt like they had to keep them inside during the smoke. So the more we can make this story human, the more powerful it is. And then the next practice is similarly one intervention that you have heard about from health or otherwise that you find exciting, that you find hopeful. So the one I'll share is I know an incredible young Indigenous leader who is working to bring solar panels to Indigenous communities across Turtle Island. And one of the first things she powered was a health center. And it's really exciting to see communities bringing power into their own hands in a clean and healthy way. So we're going to give you another couple minutes just to add in the chat, share a hopeful project that you can think of that will protect health. Maybe it's expanded transit so that people can get to appointments easily in ways that don't pollute. Maybe it's cleaner energy so children are breathing less air pollution. Maybe it's taking that initiative in your hospitals and making hospitals places of not just healing, but also of health in terms of emissions reduction. So again, there's some really exciting and hopeful things in the chat. There's also great examples of ways that you can look at and see the ways that people have framed the climate impacts and challenges. I also want to shout out again in the toolkit, there's a link to the Climate and Health Alliance of Australia created a really great guide to communicating about health and climate change. I've seen Ed Maybach on, and he did a great webinar for us talking about some of the things and points you can lift up. That's also linked in the chat. And if you'll remember, I think they're in Jenny's first slides, there were all of those incredible pediatricians, cyclists, and Diarmid from the WHO who were cycling with Ride for Their Lives in the lead up to COP. And I know that Ride for Their Lives has just launched again, and they also have resources and they're looking at building on talking about health and climate change. So again, not to like really hammer home the toolkit too hard, but all of links to all of those things are there. The last thing I'm going to invite you to do before we turn over to our WHO colleagues is we've now been on the call for an hour and 10 minutes. So I invite you to just take a quick moment and stretch your arms up, tickle the sky where we hope there's no more air pollution, wave your arms like the windmills for the clean energy. If you want to stand up, and I know an old organizer I knew from the labor movement used to say, like, bend down and get down to the grassroots and then reach up as high as our aspirations. Shake your body out a little bit. And now I'm going to turn it back to Jenny to introduce our next speaker. Thank you.
Thanks for that exercise of both kinds, both the exercise to practice our voice on climate challenges and climate solutions, and the physical exercise to keep our bodies strong and keep the blood flowing while we do this work. Okay, now without further ado, it is again my great pleasure to turn over to the World Health Organization, to Dr. Maria Neira, who is going to talk to us about the fantastic campaign that the WHO launched just a few days ago, Our Planet, Our Health. So Maria, over to you.
Thank you, Jenny. And it's such a pleasure to see you all, even on a virtual way, but see you doing exercise. I put my camera off because somebody came into the room, so I didn't want the people see me doing exercise because they will think that I'm crazy, which is good. I'm really crazy. Anyway, it's so inspiring to hear you. It's so inspiring to see that so many are joining. And I saw that, that we have more than 150 people attending. So this is fantastic. Congratulations, Jenny, and all of you for this amazing effort. You know, in Spain, we say la unión hace la fuerza, which means united, we are stronger. So this is a clear demonstration. I still have difficulties, Jenny, on believing you when you said that it's 10 years that we have been around on this group. I can't believe it. No way. I'm not ready to accept that. But when you think about the small number of people at the beginning and how many networks we are now, I think this gives a lot of inspiration and hope and optimism. Before moving into Our Planet, Our Health, I wanted to share with you information about yesterday. We have a very interesting member states briefing. You know that we don't have many opportunities in WHO because we have so many health topics that it's difficult to get the opportunity to have a special briefing for member states. And yesterday we were very lucky to have it together with UK and on their quality of hosting the COP26 and Egypt on their capacity as hosting of the COP27. And the briefing was about the health commitments of the COP26 on the decarbonization of the health system, well, the low carbon and the climate resilience. And obviously we talked as well about access to clean sources of energy, partnership, and all of this Our Planet, Our Health. The good thing is that there were many countries following. We had more than 190 participants, which is, believe me, a super record number for a participation on a briefing. And we had the opportunity to inform the countries about the health commitments, the fact that 57 countries are already committed, and we hope more to join. Of course, the activities that will be taking place in Egypt, and how the UK will be launching a partnership to implement those health commitments. So all very good news shared with member states, which means the diplomatic missions here, or the Ministry of Health, or the Ministry of Foreign Affairs at the country level. So that's give us again very positive vibes about how this is moving. Regarding the World Health Day, as you know, it's celebrated the 7th of April, but the idea is to celebrate it the whole year. So all the material that has been developed, please use it, disseminate it, make sure that this great alliance can be benefiting, that is no intellectual property. I mean, it's for use. We will be so happy if countries, groups, networks can use it. Most of the material is very well known by all of you probably, but still the fact that it's well packaged with very strong messages. I invite you to read carefully the speech of our Director General at the World Health Day. He was in Washington at that occasion, but he had the opportunity to read a powerful speech, and you will see issues like stop giving subsidies to fossil fuels. This is not good for your health. Stop using fossil fuels. Keep fossil fuels in the ground. And again, the voice of the health is very powerful when we can say these kind of things. And it has another benefit. It convinces our own colleagues, I mean, people from the health network, the health professionals, about the fact that we don't need to talk about diseases. You see, we don't need to talk exclusively about how to take care of our patients and care for our patients. We need to take care, and on a very strong and influential way, about the causes of those diseases, about the unhealthy environments we are living in. And this is why our voice can be very powerful. Some health professionals are not yet very well convinced, or maybe they don't feel empowered enough to talk about climate change, to talk about transition to renewable sources of energy, talking even about air pollution. They feel a little bit disempowered. So this is very powerful because not only we create a network talking about the climate change and the environmental hazards, the environmental determinants of our health, but as well telling them that it's fair, it's more than fair, it's our obligation, it's our responsibility, it's part of our leadership as health professionals to talk about how to influence which sources of energy a country should use in the name of health, how to protect our water and having a safety standards for water. That was done thanks to the health professionals. We need to do now the same for the standards on air pollution, on air quality. So all of that empowers us a little bit more. So the theme of this year was Our Planet, Our Health. The interesting thing is that many years ago, in the 90s, WHO did already a World Health Day, a campaign with the same slogan, Our Planet, Our Health. Can you believe it? There are many years that in the name of health, we have been raising awareness about the fact that if the planet is dying, we are dying as well, or the other way around. If the planet is well, we will be very well as well, and we will benefit from health and well-being. So just to tell you how important this network is for WHO, for the World Health Organization and partners, and of course you are part of the World Health Organization, how important this is for the world at this critical moment where we need more than ever to lead this movement, because the world needs a common sense, and I think we can provide it. We can provide these wise, healthy prescriptions on how we need to consume, produce, and look at our resources. I think this energy transition, we had already plenty of arguments to push for it, but now I think we have an extra one that I don't need to remind you, which is conflict as well, and then humanitarian reasons for it. So your voices are extremely important. I hope that in this COP27, we will make even a stronger voice and a stronger presence that last year in Glasgow, which was great with this healthy prescriptions letter. We need to insist, or maybe we need to use the letter again, but this time we can work on the tactics to make sure that the letter will be very prominent at COP27. So we can work on that all together, and as well, we will keep trying to bring as many networks and making sure that this group that is now a very nice network, we can even bring more, because the power of the health voice cannot be underestimated, but our level of ambition cannot be big enough. It's never big enough. So we need to go for more. And this COP27, we will make a lot of good noise, the good one, good presence. And I hope that the health will be, again, a little bit more prominent than last year, but not as prominent as next year. Thank you all. Thank you, Jenny. Back to you, and keep pushing. This is green for health is extremely important.
Thank you so much, Maria. And yes, I think to just re-emphasize your point that the folks on this call, the signatories of the letter, can be very influential, both in driving, working to drive the climate agenda, and in influencing our peers in the health community to also come along and recognize that, yes, we have the right to speak about climate change because it is a driver of people's health. The environment, that environment is essential to enabling people to be healthy. So we have every right to be speaking about that, and a responsibility to be doing so. I will just say that the World Health Day WHO materials are fantastic. And they too are linked from the toolkit that we will share with folks, along with a number of other WHO materials. But check out the World Health Day materials. They really are good. They're beautiful, beautiful materials for sharing the message. So then the kind of last portion of this meeting is an opportunity to go deeper on the 4 key issue areas that were elevated in the Healthy Climate Prescription Letter. Investing in resilient, low carbon, sustainable health systems, transferring of funds from high income to low income countries to help implement the necessary mitigation, adaptation, resiliency measures, fully and justly phasing out fossil fuels, and updating national climate commitments to align with that target of limiting warming to 1.5 degrees, and integrating health into those national commitments and policy making.
Thanks very much for everyone who stayed in the main room for the climate resilient, low carbon and sustainable health systems, which will have presenters from the WHO and Healthcare Without Harm. And first, I'll give the floor to Elena Villalobos-Prats. She's responsible for training and technical support to countries in the Climate Change and Health Unit of the World Health Organization in Geneva. Thank you so much, Elena, for joining us.
Thanks so much, Milena, and thanks so much for inviting WHO to be part of this important session. So basically, we will just provide a brief introduction on the initiatives on climate resilient and low carbon sustainable health systems. You already heard from Ted Leonard about what happened in COP and the initiatives, but given the importance of these initiatives and the important synergies that are related to the prescription letter, we thought it would be good to provide an overview of the 4 initiatives. As you can see in this image, is basically priority focus on health systems, so both climate resilient health systems, but also health systems leading by example, and everything they can do also to reduce their emission. So basically also, you know that NHS was the first health system to commit to net zero in October last year, and then since then a total of 18 countries, including them, have done the same. Also, as part of the COP26 health program, there was an initiative on promoting healthy NDCs, basically ensuring that health is integrated into the commitments from countries to reduce their emissions. And then another one, which basically, thanks to the action and the motivation from all of you, was a real success, was the one of mobilizing the health voices for climate action. The key actions that I want to discuss now and to present is basically the commitments that were made by ministers of health at COP. As of today, 57 countries have committed to the climate resilient and low carbon sustainable health systems. Basically, ministers of health committed to their own populations to strengthen both resilience and reduce the emissions of their health operations. Specifically, these commitments are looking at understanding which are the impacts of climate change at population or healthcare facility level, basically conducting what we call climate change and health vulnerability and adaptation assessments, then build on that evidence to develop comprehensive plans to address those, basically the health component of national adaptation plans, and then use both this evidence and the plans to try and mobilize financing for health, for climate change and health. As part of the initiative on low carbon sustainable health systems, there are kind of 2 approaches. Those countries that are more historically responsible and high emitters basically have committed to set a target date by which to achieve health system net zero emissions, ideally no later than 2050. And then all countries have committed to understand where their emissions are coming from and conduct baseline assessments of greenhouse gas emissions at health system level, including supply chain, because as you know, this is the key part of the service delivery that is responsible for most of the emissions. And then all countries also commit to develop action plans or roadmaps to basically reduce their emissions and make sure that their operations are more environmentally sustainable. As I said before, these are the 57 countries that have committed so far, and they are well represented in all regions. Most of them, I would say 19, are represented in the African region, 11 in Eastern Mediterranean, and then many in Europe also, and in the Americas. Next steps, and I think this is my last slide, as briefly mentioned by Maria and by Leonard, basically, we are now discussing with FCDO how we are going to establish a partnership for action on climate and health, basically looking at the commitments in a first step and try to move to implementation and support those countries that may need support to implement those, but really also looking at making sure that the knowledge that is out there, the experiences from countries is made available to others and the community of practice is established. Then some regions are organizing or have organized meetings to bring together these countries that have committed and revise their commitments, and then WHO and partners like Healthcare Without Harm are already planning which is the support that they are going to provide to different countries. Synergies with the policy calls to action included in the letter is of course everything related to ensuring that the NDCs include health. Then this call to developed countries to make sure that the funding, the promise they made to mobilize 100 billion per year is real, and that a portion of that goes to health. Then, of course, clear overlap with the call for action on climate resilient and low carbon sustainable health systems. And then I think also a very important point is this call to countries to ensure that everything they do with regards to adaptation and mitigation is looking to health and equity. And this is basically what we are also trying to do with everything we promote. And I think this point on equity is critical. And this is something that is relevant with regards to the commitments from countries and the level of ambition that they are aiming to have, and also accountability that I think should be different. And also is related to how we assess vulnerability, for example, at population level. So with this, I hand over to Josh to provide further information on the Race to Zero.
Thank you, Elena. Next, I'll give the floor to Josh Carliner, who is the International Director for Program and Strategy for Healthcare Without Harm, an international NGO that works around the world with the healthcare sector to enable it to reduce its environmental footprint, become more sustainable, and advocate for environmental health and justice.
Thank you so much, Milena. And let's see, I hit share. Are people seeing?
Yes, we are.
Okay, looks like there's a few different PowerPoints open on my desktop. I'm hoping you're seeing the right one. Do you see the healthcare climate footprint?
Yes, it's not in full
okay.
screen size.
Yeah, it doesn't seem to be quite. There we go. Okay.
Yeah.
All right. Thanks so much. So thank you, Elena, and thank you to GCHA for inviting me today. I just want to give a really quick background here, why we're talking about this. So in 2019, way back in ancient history before the pandemic, Healthcare Without Harm released a report that found that healthcare's climate footprint was equal to more than 4.4% of net global greenhouse gas emissions. In other words, if healthcare were a country, it would be the 5th largest greenhouse gas emitter on the planet. And one of the recommendations of that report was that the health sector needed to create a roadmap and a plan to decarbonize and align itself with the ambition of the Paris Agreement. And so last year, exactly a year ago, in fact, we released this global roadmap for healthcare decarbonization that found that if there was no action taken, healthcare's emissions would triple by 2050. So one of the reasons that we need to take action is not just to take it down from where it is right now, but in fact, healthcare's emissions are growing significantly. So the roadmap charted a course for decarbonization of healthcare and zero emissions with resilience and health equity. And in many ways, the COP26 health program that Elena was just talking about is sort of embodying steps along that road to actually achieve this vision of aligning the sector with the ambition of the Paris Agreement. And so, just to add to one thing that Elena said is that there are 57 countries committed now to resilience and low carbon health systems. 15 of them are committed to net zero emissions already. In conjunction with that last year, the other thing that we saw was that more than 50 healthcare institutions representing the interests of more than 14,000 hospitals and health centers in 21 countries joined Race to Zero and made net zero commitments as well. So while the government commitments are happening from the top down, there's also a growing groundswell of hospitals and health systems that are taking action on climate and moving toward aligning their own as non-state actors, as subnational governments and as private health systems and other public health systems to aligning with the ambition of the Paris Agreement. So that's all really exciting. There's tremendous momentum that we've come out of COP26 with. And so what's the way forward, which is what we're supposed to be discussing here today. So just, one of the things, there's sort of three areas that Healthcare Without Harm is focusing on in the way forward. And I want to talk mostly about this third area with the group, and hopefully we can open up for discussion because that's what this webinar is supposed to be about. But we're working to support countries that have committed to the COP26 health program by providing support around baselining and action planning. We're working to pilot a methodology that will allow governments to do this at a national level. We're working with the government of the Netherlands, which is a participant in the COP26 health program, with Portugal, with the subnational government region Lazio in Italy. And we expect to be working with a number of other governments to do that. We're working in collaboration with UNDP on a long-term project to decarbonize the healthcare supply chain. And of course, we need to mobilize finance. We're also working to, we've got together with some other organizations, there are a couple of different tools that are allowing health facilities to set their baseline and develop action plans as well. And then the third area is really the health sector itself needs to mobilize to decarbonize, become more resilient, and to become an advocate for a healthy climate. And so these two things are intertwined. And that's what I want to kind of share with you in this next slide, is that these are the actions that we have charted in the roadmap that can save 44.8 gigatons of emissions reduction over 36 years, which would be equivalent to the entire world's greenhouse gas emissions in 2017. So clean renewable energy, investing in zero emissions buildings and infrastructure, transition to zero emissions sustainable travel and transport, healthy food in climate resilient agriculture, incentivizing and producing low carbon pharmaceuticals, implementing circular healthcare and sustainable healthcare waste management, and establishing greater health system effectiveness. This would get us a long way to decarbonizing hospitals and health systems. But the key thing here that I want to emphasize is that this has to happen along three pathways. It has to happen in healthcare operations, but it also has to happen in the supply chain and in the broader society. And so in order for healthcare to decarbonize, what we found is there has to be a broader decarbonization of civilization. And in other words, we need to move away from fossil fuels, what Maria Neira said. In order to do that, healthcare needs to advocate for that broader decarbonization. In order to decarbonize itself and align with the Paris Agreement, the society that healthcare depends on has to do that. And so I want to end with this little slide as sort of a teaser here for folks and maybe a discussion starter. If we achieve these 7 high impact actions across these 3 pathways, based on a study in Nature that was published last year, it would contribute to a societal decarbonization that would save 74 million lives by the end of the century. And the healthcare portion of that, if healthcare were to decarbonize, it would save an additional, as part of that 74 million, 4.8 million lives. So in other words, the point I'm making here is that healthcare cannot decarbonize in isolation. It cannot become resilient in isolation. It has to be part of a broader societal effort. Therefore, the work that's happening in the COP helps healthcare decarbonize, and the work that's happening in all around the world at the grassroots level and national government level, and the work that we do to decarbonize and build resilient health systems has to and can contribute to this broader goal. And those two things are totally intertwined. So I guess my question for the group might be, how do health professionals who have signed this letter actually get at that interaction between community resilience, societal decarbonization, and creating low carbon, climate resilient health systems? Thanks very much.
Hi, everyone. Nice to meet you.
Hello, nice to meet you.
Nice meeting you too.
Good to see you, Martin. I think
It's a
Martin is
pleasure.
the only one that I already know. So wonderful to know new people. I'm Jess. I am the policy analyst with the Global Climate and Health Alliance. I work in London and I care about climate because I have a background in public health and swiftly realized that if I cared about the issues I was working on, then the best way to protect them was by addressing climate change. And I am going to pass to John Davies.
Oh, hello there. So my name's John Davies. I'm a policy manager with the Royal College of Physicians in London. And in terms of our interest, I mean, probably quite similarly. I mean, it's climate change is increasingly a really big issue for our members who essentially see it as one of the biggest threats to health in the 21st century, really. So yeah, it's an agenda that's becoming increasingly prominent for the people that we represent and that we think is really, really important to address from a health perspective.
I'll just give a couple more moments for anyone else to join this breakout group, and then we can get started. If people would like to introduce themselves in the chat, please do feel free. But we may also have introduced ourselves in the chat several times today, so no pressure to do that if you'd rather not. Okay, there are 11 of us now, so I'll get started. So thank you everyone so much for joining this breakout session, and we're going to use it mainly to discuss NDCs, but also some other ways to be integrating health into climate governance, including long-term strategies briefly, and then national climate commitments. And so pleased to have James Burlam here from the Public Health Association of South Africa to go into a bit more depth at national level on what that sort of policy engagement might look like. So health is so important to including climate policy, as we all know, both from the perspective of raising ambition through making the impacts of climate change tangible, but also to ensure that health co-benefits of climate action are maximised across both mitigation and adaptation efforts, with the benefits including clean air, healthy diets, physical activity, and safe and reliable water supply. To say a little bit more about NDCs for anyone that isn't already familiar with them, these are nationally determined contributions, which are national plans and commitments to deliver the Paris Agreement, and they're submitted every 5 years to the UNFCCC. And in 2021, GCHA looked at the inclusion of health in these commitments through its Healthy NDC Scorecard initiative. And we found that 90% of the 94 NDCs that were submitted by the start of October last year included health to some extent. Most mentions were on impacts and adaptation, and there were fewer for health co-benefits, and only about a third on economic, and only about a third of those NDCs covered economic and financial considerations relating to health impacts, health adaptation, and health co-benefits. So we can see where we need to improve. In terms of what happened at COP26, some of the key outcomes there were that governments were requested to resubmit their NDC if it hadn't yet been updated since the 2016 version, or if it wasn't yet in line with the Paris Agreement of limiting warming to 2 degrees or 1.5 degrees. There have been 60 or so NDCs that have been submitted since COP, so hopefully there'll be a few more coming through this year, and we will be updating the scorecard accordingly. As well as NDCs, countries are also due to submit long-term strategies to achieve net zero by 2050. And there's good coverage of health in these, actually slightly better than in NDCs. 94% of the 31 countries that had submitted a long-term strategy by the end of July last year did mention health. And it's really interesting to look at the language of these long-term strategies. It's much more optimistic in many cases than might be found in an NDC, which is perhaps slightly reflective of the fact that governments that are writing the long-term strategies are not going to still be serving their term at the time the long-term strategy needs to be delivered. But it's really encouraging to see that the health links are recognised so well in long-term strategies. And there's likely an opportunity to be calling for particularly ambitious language in long-term strategies, and then for NDCs that are submitted in the coming years to match that. Finally, it's worth thinking about health being included in national climate commissions, which is something that James is going to speak to us more about. So without further ado, and to make the most of our few minutes together, James, I'll pass to you. Thank you so much, James.
Thank you, Jess. I'm just going to share my screen. You should be able to see that. Okay, let's just share that now. So thank you, Jess. Okay, and thank you for the opportunity to share with you all again. This is a brief presentation about our experience as a climate, energy and health special interest group of the Public Health Association of South Africa. And particularly regarding the NDC and the, sorry, I'm just going to see my screen there, right. So the story just begins with the first launch of the NDC in March last year, with the target mitigation ranges of 2025, 398 to 510, and 2030 from 398 to 440. We as a public health association partnered with the South African Medical Association, AMREF Health Africa, and with the help of GCHA, made the point in our submission that healthy and ambitious NDCs are a cornerstone of the healthy recovery from COVID, that the healthcare sector is a significant emitter, that there are solutions to mitigate climate change that will have significant impacts on reducing deaths from poor air quality and poor diet and increased active travel. And included in our submission was a policy roadmap on the recommended mitigation policies across the sectors of energy, food and agriculture and transportation that GCHA's partners helped us to put together, which showed that including these policies in the final NDC would accelerate a just transformation in South Africa, which has massive challenges with unemployment, with air pollution from coal-fired power, and also with poor implementation of policy around air quality. The Presidential Climate Commission, which was established in 2020 to inform the South African climate response, recommended to Cabinet that the NDC emissions be lowered to 350 to 420 by 2030. This was based on research commissioned from the University of Cape Town, amongst others. And in September 21, Cabinet approved those recommendations. We welcomed that in our press release on the 1st of October, and again reiterated the need for bold climate action as one of the greatest public health opportunities of the 21st century. We also referenced the GCHA scorecard that scored South Africa 12 out of 15, up from the previous 7, for including mention of health and heat waves. And this press release said that South Africa at that stage was a leader amongst the world's 20 biggest emitters of greenhouse gases in taking action to protect its people's health. However, the carbon tracker still rates the South Africa's target range as insufficient overall, not yet Paris Agreement compatible. And it further goes on to show that in terms of policies and action and domestic targets and its fair share target, we are almost sufficient to insufficient. And in South Africa, we also have the challenge of implementation of policies and actions. And recently, a significant court action by a partnership of environmental groupings held the government to account for its lack of implementation of air quality controls in one of the most polluted areas of South Africa, where all our coal-fired power is generated. So it calls for constant vigilance by civil society. We have the Presidential Climate Commission, as I mentioned, which is a multi-stakeholder body that has been consulting civil society on the just transition to renewable energies and climate finance. And this just transition framework is something that has been very much in the news recently, with these multi-stakeholder conferences and dialogues around the country happening. And as a special interest group, we have made comments on the framework for just transition, along with many others, and we'll be engaging with the head of that commission and his commissioners next Tuesday. Firstly, just to discuss the relative absence of health in the report, and also the absence of health in the Climate Commission, even though we do have commissioners who are very sympathetic to the case for public health. So I'm hoping after that meeting next Tuesday and with the multi-stakeholder conference that there will be more good news to report about health in our climate plans. Okay, so with that, I'll stop sharing, and if there are any questions, please feel free to ask. Thank you.
Thank you so much, James. And yeah, I would really love to know if anyone does have questions for James. Please speak up and don't hesitate. Marjorie, please do speak.
James, I'm in the British Isles and I'm putting particular emphasis on the word Isles. I get incredibly frustrated with our government that they won't take up on the power of the sea with wave kinetic energy to tap into. And although I'm recognizing that you are quite a large landmass, you do have quite a big area of coastline and where oceans meet. So have you also thought about the benefits of kinetic wave energy production?
I understand that there have been some experimental projects looking at it. Some years ago, I heard of one off the east coast of South Africa. But the focus in South Africa on renewable energy has been wind and solar, including concentrated solar power and then solar PV. There is also significant wind resources close to Cape Town. There are several wind farms, and so wind and solar are really the dominant ones. I'm not sure of the particular financing of kinetic wave energy. I imagine that it's not at this stage economically competitive and hence hasn't been seriously looked at. Thanks for the question.
You said something very important there about economically competitive, and this seems to be the issue when we get a clash where people are concerned about their profit margins, when common sense would be better to be prevailed, because what use profit if you haven't got an earth to sustain life?
Absolutely, and I think James is... Sorry, James, you wanted to respond?
No, I mean, I don't disagree with that. I'm just saying that solar and wind in South Africa are the priorities, and there is a movement on the renewables. We're seeing more being open to private producers after a long period of government stalling on that. And so there is some hope that we'll start to see renewables coming in more significantly. But coal is still the overwhelming power source, and it's a huge environmental cost.
Thank you, James. And thank you again, Marjorie. Does anyone else have questions for James, or otherwise, if you'd like to share any work that you're planning yourselves on NDCs or integrating health into climate governance processes, no matter whether it's ongoing or planned or triggered by anything that you've heard today, it would be wonderful to hear it. In that case, then maybe just a brief comment from me on how exciting it's been to see some of the policy change in South Africa. I think in policy, it's so hard to attribute change to anything that one particular organization has done. And certainly it would, you know, the improvements in overall mitigation ambition in the South African NDC is the combined result of the work of many, many, many organizations. But I think that increased mention of health would only be due to a very small number of health organisations. So huge congratulations to James and to the other organisations that were involved. It was an absolute pleasure to be part of it in a very small way. We're about to get removed from this breakout room, but if people have other questions that they'd like to ask, please do pop your questions in the chat or your comments, and we'd love to follow up later. Thank you so much, and see you back in the main room.
Be the leader in the in European in new steps towards new Europe, sort of say, and as east you go, the picture is a little bit less positive, but still there are some announcements for a coal phase out. So this is definitely a positive turn. Like 5 years ago, there was basically coal countries did not want at all even talk about coal phase out. And within this plan of Green Deal, we have a big portion of big chunk of funds dedicated to the just transition, which includes basically like transforming those coal regions at least. So it's not included gas and oil or other kind of infrastructure related to fossil fuels, but coal regions, so mining regions and a little bit less power plant regions. To transition to some other productions, or and we have been looking for these health arguments within the just transition. So it's part of the there was a big change and switch in EU perspective since the Ukrainian war started, and that was basically awareness that Europe is greatly dependent on Russian gas, and prices here are going extremely up due to the prices of gas, energy insecurity, and so on. So EU made a big plan to repower, they call it Repower EU plan, to cut off Russian gas by 2027. So they announced independence from Russian gas, but not gas phase out or gas reductions in total. Which is one of the challenges, obviously. We do not want, for example, US fracking gas and fueling the climate change again with some other fossil gas or whatever gas, natural gas as they call it. Okay, this is our tweet I want to share about Ukrainian war and what's going on in terms of power and gas in Europe. There are really a lot of environmental organizations vocal around this dependency of Russian gas. However, our stand is that at the moment, at least, we want to support Ukrainian, kind of acknowledge the suffering rather than say much about the energy side of it. But definitely it will come. And one of the big challenges right now is basically proliferation, I will use Jen, your word, of false solutions to the fossil fuels crisis. So gas is not thought so much as a phase out of a gas, but imports from other countries or building up infrastructure for putting the European gas on or increasing the production and so on. Other talks are going into the direction of using more renewables, but some of those renewables are wood burning, which we know that it's still air polluting, this health harming. So yes, these are the things that, like, in between the lines, there are a lot of things going on that are not actually health transition, but rather some transition. So with that, I will end my part of the discussion, and maybe this can serve as a kind of some of the points for your thoughts.
Thank you so much.
Over to you.
Thank you so much, Vletka. Again, so wonderful to have the context of your work and the things you're focusing on. I'm going to talk briefly about something called the Fossil Fuel Non-Proliferation Treaty that is being convened by environmental groups, but has had huge support and sign-on from other folks in civil society. So when I first heard about the Fossil Fuel Non-Proliferation Treaty, I was honestly quite skeptical in that I just realized I hadn't fully pressed share my screen. There we go. I was initially skeptical in that I thought that perhaps it was just another media moment or a sign-on letter. And I wasn't sure how impactful it would be. But the more we've been in conversation with the groups that are organizing around the Fossil Fuel Non-Proliferation Treaty, they are in conversation with government, and they are looking to bring this in as a sort of as an international mechanism that has weight and legal power. They're building on work that has been done around landmine and nuclear weapon non-proliferation treaties, they see it sort of as something that goes in addition, whereas the Paris Agreement was about targets, this is one mechanism by which governments could be more compelled to reduce take the actions they need to actually meet those targets. Again, the three pillars of the Fossil Fuel Treaty are non-proliferation, so an end to all of the expansion of fossil fuels, phase out of the existing production, and a just transition to ensure that no worker, community, or country is left behind. I'm going to just, one of the things that GCHA is in conversation with the Fossil Fuel Treaty about, along with Healthcare Without Harm and Physicians for Social Responsibility, is drafting letter text that is health specific. So there have been letters from academics. This is the one from academics and scientists, but there have also been statements from youth. I'm getting a bit of feedback, so I'm going to turn my video off. There have also been letters from youth, from faith communities, and from cities. And so we're again working with a couple of other groups to draft language that is health focused, so we can bring the health voice. To that end, you can actually sign the treaty without the health language, but we felt that it was important to add the health lens here as well. We're as we build that letter, we're planning to shape it around the Healthy Climate Prescription Letter, as this is a really direct takeaway from that call to phase out fossil fuels. And so if this is something you're interested in and want to learn more, we're going to hold a workshop with the folks from the Fossil Fuel Non-Proliferation Treaty that just shares more information about the work that they're doing. And they can give you a much better sort of sense of like the legal case and some of the work that they're doing at the beginning of May. So with that, I will stop sharing my screen, and we've got about 2 minutes if folks want to ask a question or share a comment.
Where can we endorse the health part of this treaty?
Thanks, Lisa. We're just in the midst of writing the health letter, and we'll send that around to you when it's ready.
But currently it doesn't focus on health?
No, currently there isn't a health focus. It's a broad call for the non-proliferation of fossil fuels in general.
Okay, thank you.
Thanks so much.
May I have a question?
Yes, please.
Well, I'm Carlos Mediano from Medicus Mundo International. Just to tell you that here, for example, in Spain, now the electricity cost doubled than last year. And there are some voices that said it's because we stopped nuclear electricity and we go too fast in decarbonize. With this treaty, we are speaking about something about nuclear electricity or nuclear. Maybe there are some people that can think about decarbonize, but then do it with nuclear plants, you know. And the second question is, are we not speaking nothing about degrowth? Because I think our problem is that we continue growing. Even if it's green, I think it's not sustainable. So I don't know if you speak something about that also. Thank you.
Is this question for me? So we do include the degrowth in our talks, although it was not. We don't have a dedicated, position on this or some more elaborate talk on it. But definitely this is a part of this. Yes. I think also I see that Lizzie commented about hydrogen, and there are so many fossil solutions, and not just that, but as well degrowth. It seems that we need something more elaborate on those topics as well.
Okay, thanks.
Thanks, Letka. Anybody? The breakout rooms are going to close, but there will be 60 seconds in which people could continue to have a conversation as they close.
And to take full advantage of the time that we have in the finance session here, let's go ahead and get started even while people are making their way to the other breakout rooms, and folks may get a little bit of a taste of climate financing before they go. One of the areas that the Healthy Climate Prescription Letter marked out as an area that calls for action is the call for wealthy, high-income countries to deliver climate funds and climate financing to low-income countries to support and enable the kinds of transitions, both mitigation and adaptation and resilience, that low-income countries need to make and need support to be able to make. So the wealthiest countries are the historically have the historical greatest responsibility for climate change that we're seeing now, have the resources and the responsibility, therefore, to provide support to countries that are in many cases feeling the worst impacts. And indeed, a recent WHO survey showed that 70% of countries have cited the lack of finance as a key barrier to implementation of their climate and health plans and strategies. Without a lot more preamble, because I want to make sure we have a bit more time for discussion in this session, I would like to introduce Paul Watkis, who recently co-authored an article with Chris Ebi about this exact issue, the need for climate financing for particularly for health adaptation. Paul, please tell us a little bit about yourself, and then talk to us about the state of global climate finance and what's available for health, and what some of the barriers are to that being more readily available. Over to you, Paul.
Thank you, Jenny, and good afternoon, good morning, everybody. Yeah, so my name is Paul Watkis. I work on adaptation finance a lot. So as well as sort of supporting countries in applying for finance, I also work with the UNEP Adaptation Gap Report, and they do a lot of work on trying to look at these finance gaps. And so I suppose the first thing to do is just to say what the state of play is. And one of the positive stories is that overall, climate finance is increasing. And if we look at the latest numbers that we have, around $630 billion was flowing in terms of climate finance internationally. So that's a really big number. It's a number that has increased quite significantly over the last decade. But actually, when you dive down, there's a number of important messages there. The first one is nearly all of that finance is flowing with respect to mitigation. It's a mixture of public and private, about 50-50, but nearly all of it is going towards mitigation and you know, energy efficiency and renewable energy, because that's very easy for both the public and the private sector to invest in. What we find is that a very small proportion of that, perhaps only 5%, you know, maybe $45 billion a year, is going to adaptation. So we see this very big difference between the mitigation and the adaptation side. And we also see that nearly all the finance in the adaptation space is coming from the public sector. So that's one big message. And the second message is when we drop down to the health sector, particularly if we look at health adaptation, of that sort of $45 billion, only about 0.5% is going to health adaptation. So we see this really big difference between what we perceive as being the problem in terms of the needs, the risk of climate change on health, and also the adaptation needs, and then actually what is flowing in terms of the finance, particularly for adaptation, but also to an extent for health mitigation as well. So that's the big story. The next question is why, of course, and the why is a little bit more difficult to answer, but certainly some of the reasons are that we perhaps don't have it's more difficult to invest in adaptation than it is into mitigation. There's less opportunities for the private sector. There's more competition for public sector budgets in the adaptation space. And one of the things that's sort of happening is health adaptation is being crowded out by other areas. So some of what we need to think about is why that is, and it's partly some of the political economy around which the strong ministries, who gets the money, who outcompetes. But it's also a case that health hasn't been able to perhaps put as much information out there with respect to the health impacts and being able to put sort of detailed plans together on what it needs in terms of adaptation finance as well. If I stop there, that was my little introduction, but very keen to hear any discussion from the audience and any further questions from you, Jenny, as well.
Yeah, absolutely. So I'd like to open it up. We have a number of people in the breakout session here. Does anybody, has anybody in this group worked on or engaged on the issue of climate finance for health? Are there gaps in your knowledge? We know that this is kind of a new area for the health community. There are no dumb questions in this session where, many of us are learning about this issue. So feel free to ask questions and deepen your knowledge. Yes, let's see, Mark Hayden, please.
Yeah, I'm going to call it dumb. So what would finance for health adaptation look like? Perhaps in sort of, where I work in London, and where maybe most of the money perhaps should be going, say, the global south. I mean, what would be a couple of examples of what you would say we should be putting the money into for health adaptation? And how would we I don't know that we need to, but how would we explain that as different from what we've always been doing on malaria, or, you know, that basically the things we're doing, you know, how do we delineate that, I suppose, is the question, to sort of understand it better rather than because it needs delineated.
Yeah, Paul.
Excellent question. Very a nice starting point, I think. Yes. So, I mean, one of the things is that we, in terms of what we might be looking at, you know, climate change and health there's partly things that might be, what we might traditionally say fall within the health sector, but there's also lots of areas that relate to health that are within other sectors as well. So it becomes a little bit messy. But typically, we might be looking at trying to increase investment in, you know, in WASH, for example. We might be, you know, water and sanitation. We might be particularly looking at things such as disease surveillance and monitoring. We might be, you know, trying to look at you know, some of the issues related to disaster risk reduction and sort of early warning to protect people's health. There's a range of things that we might want to do. I think you're absolutely right that many of those do tend to cross over with existing interventions, and so particularly, you know, there's a question about where, you know, health stops and adaptation starts, and in many ways we see it, I think, as a spectrum. I think that the key thing perhaps is just, you know, when we're thinking about the adaptation side, we tend to think about things with a stronger climate rationale, you know, trying to have a stronger think about where climate change is driving that impact and increasing it. And also it sort of relates to some things that we might want to try and push more investment into, which are what we might call no regret options anyway, and things that are good to do because of the current climate risks, but will be more important. But also complementing those, trying to think about the problems that are starting to come down the road where we need to scale up. So, you know, typically that might mean more focus on, you know, new diseases in new areas. That might be that type of thing. But, you know, across the board, it's looking at where we might need to do things slightly differently. And you know, looking further ahead, there might be some things where things really do start to become sort of non-linear, where we might need to scale up quite significantly. But definitely the message is the flows of finance need to go to, you know, as you said, the sort of global south, you know, but also, you know, I think there is this issue about increasing what we're doing, more of what we're doing already, but also starting to do some different things. I can see lots of hands going up already.
Great, thank you. Let's now go to, and I suspect we're gonna run out of time again. So let's, if I could ask you to keep your question or comment streamlined, but let me go to Vanessa Forsyth and then to Bidhan Chandra Paul. Vanessa, please.
I just wanted to mention about Jubilee and the upcoming IMF and G20. You know, there's been special drawing rights, billions of dollars that the wealthy countries got during COVID, and, you know, trying to get this money to go where it's needed in terms of the most vulnerable, and set up a sustainability trust fund that will actually address climate change and its impact for the more vulnerable, poorer nations. So yeah, we're doing a chain around when they meet in Washington, DC in October. Yeah, I just don't believe people see the connection always between what is happening in terms of disasters and climate health and the impact it has on all of us, no matter where it's happening.
Yeah, very good point. Let me turn to Bidhan Chandra for your intervention before turning back to Paul to wrap us up.
Yeah. Thank you very much. This is Bidhan Chandrapal. I am aware of that every country has a national committee, and also government is leading to allocate fund in every country. Like Bangladesh, we have also a national committee. But is there any provision to form a search committee internationally to allocate funds in regards to adaptation or mitigation, especially to search innovative initiatives and for special research-driven initiatives, because that is really necessary. So is there any provision to form any search committee internationally to give funds to special health research initiatives in regards to climate change? Thank you very much.
Thank you for that question. Paul, do you want to respond to both the comment and the question?
Yes, I mean, I think in terms of that, there are so the global funds tend to go through international organizations, or partly anyway, and so countries do have national committees and produce nationally determined contributions to set those out. I think one thing that's worth highlighting is that certainly if you go to someone like the Green Climate Fund, for example, they'll fund you with a project as long as it's nationally owned and put forward, but they won't fund research. So one of the things is that they are very focused on trying to get implementation out there. And so you probably have highlighted a little bit of a gap with some respect in terms of some of that international funding is trying to deliver impact rather than research. There are other forums and foundations and activities going on in the research space, but they tend to fall outside that sort of that international focus. And so I think there is an issue there, particularly with the health sector, about the connections. But so, you know, that's one thing that I think is probably worth raising and feeding back. I think there's a couple of other questions coming if we have time, but I think in terms of the question about the sort of, you know, the IMF and the scale up of finance, you know, I can say this because I'm not a politician, but the cold hard reality is there isn't enough adaptation financing by probably almost an order of magnitude. And whatever happens, we're not going to be able to fill that gap because we're not going to be able to fill it with private sector finance, particularly in sectors such as health. So I think one of the things that will have to happen is a little bit more of a prioritization. And I think there's also going to be a need to provide a stronger argument on why health should get its share. Otherwise, there's this risk that, you know, because there's not enough finance to go around, you know, because we're probably going to have a little or a lot more climate change than we anticipate, then this is going to be a bigger issue. And what we don't want is countries having to borrow to fund adaptation. That's then unjust for that to happen. And I think there's a concern that some of the sort of borrowing that's been sort of pushed out there is actually increasing the fiscal burden and increasing the debt levels of countries. And if you're in a situation where you're having to borrow for doing your adaptation funding, then that's just unsustainable. I can see two other quick questions that we may not have time for, Jenny. But...
I think that is oh, here we go. Ken of Uganda, please, over to you.
Yeah, thank you very much, GCHA, for this platform and the opportunity to speak to this platform. I am Kenneth Alan Owani, the Executive Director of Global Support Development Initiative, a locally focused NGO that is working in the rural areas of Uganda. We are very particularly been focused in the area of climate change, combating climate change, adaptation and resilience. And we have been working especially with the young people, targeting the young people, and as well as integrating our climate health education into the health issues. As we implement the adolescent sexual reproductive health services in the communities that the young people demand, we integrate the climate issues into our interventions. And I must tell you that I agree that we are very afraid about Uganda with the statistics from the World Health Organization that say that 13 million people will die by 2030 as a result of climate change issues. And I want to state here that Uganda is among the countries that if we don't intervene and do something in the area of climate education and combat climate issues, we shall really be affected so much. I would like to state here, this topic has been very important, as I want to say that issues of climate risk has been very much in Uganda, too much of floods and prolonged drought. As I talk now, there is total dry spell in the country in coming back like around March of every year, March or April. But as we talk up to now, the whole country is still into total dryness. There is no rain. So what must we do? We really need to do something like climate smart agriculture. We need to introduce some innovative approaches that can help our communities. Otherwise, the people will die. We really need a lot of interventions and collaborations and partnerships and people coming on board to join hands so that we can educate our communities. And we have also been doing more of afforestation, training and planting of trees in institutions and schools along the roads, and encouraging households to do a lot more of tree planting. And we also need a lot more in the area of recycling of disposables like medical waste. It's everywhere in the developed cities, in the upcoming cities and towns. And so there is a lot that we need to do. We also need to do in the area of recycling of disposable and advocating for reduction of greenhouse gas emissions, and also empowering of empowering our communities economically, because there's a lot of high rate of poverty in the area. So we really need a lot of interventions, and we have open hands for collaboration and partnership with the like-minded people like GCHA and other partners. I thank you.
Thank you so much. Those are exactly the sort of issues that this topic, speaks to, which is the extraordinarily significant risk that some countries are facing, and impacts that Uganda is experiencing, that other countries are experiencing, without, when your country has not been a major contributor to causing this problem, but is experiencing really severe threat from climate change. And it does take global collaboration and the voice of the health community to help drive attention to that issue and help drive financing and technical support to address exactly the kinds of things that you were just highlighting. So thank you so much for really clarifying what's at stake here. So we're a few minutes over time, and I thank all of you for hanging in there with us for an extra few minutes on a long meeting. This has been an extraordinarily rich conversation. Thank you to all of you for joining us. Thank you for having been engaging in the first place with a healthy climate prescription. Somebody on the GCHA team will share a link to the toolkit that we've been talking about, where there are resources to help you learn more, take next steps, think about initiatives that you might get involved in, and do, connect with some of the materials that we've talked about today. GCHA will also be hosting a monthly webinar series and other events to bring us together again in various ways on these different issues. We also are very keen to collaborate with all of you to take this issue forward, to raise the health voice, calling for the kinds of actions that we all really desperately need to see this year immediately and in the immediate years to come. So let's raise our strong voice together and reach out to us, collaborate with one another, use the toolkit. And also, if you have things to share within the toolkit that you think would be valuable to others, or that we should be sharing in other ways, please send them to us. Thank you, everyone. With that, I am going to close with one final remark, which is that GCHA is poised to retweet your tweets. So the Twitter toolkit that we shared earlier, if you're ready, willing, and able to do a tweet at a G20 leader about these issues, please do. We will retweet you. And please retweet one another. We will also share a Twitter list of healthy climate prescription signatories so that you can follow one another if you're active in that social media space. Let's elevate each other's voices and become a stronger voice together. Thank you to WHO for joining us on this event and collaborating with us to mount this event. And most importantly, thank you to every one of you on this call for the great work that you're doing to address this really daunting and important issue that we can only address if we work together. So thanks and have a great evening or rest of your day.